Hi, my name is Kweko. I'm a pharmacist. In this video, I'll review most of the important things that you need to know about the medication Trazodone. We'll cover its uses, how it works, how to take it for best results, and some precautions and best practices. As always, this review is for informational purposes only, so please do not stop, or make any changes to your medication without first talking to your doctor. So let's start with the basics. What is Trazodone? Well, Trazodone is an antidepressant that belongs to a group of medications called serotonin modulators. Now, you might also hear it referred to as an SARI, which stands for serotonin antagonist and reuptake inhibitor. What makes Trazodone special is that it has a unique way of working that helps with both depression and sleep problems, which we'll talk about in a moment. Now let's take a look at what Trazodone is officially approved to treat. Trazodone is FDA approved for treating major depressive disorder, which we simply call depression. In reality, though, Trazodone is highly prescribed for depression these days due to its sedating effects. It is more common to see it prescribed for conditions for which it is not necessarily approved but still works effectively. Something we refer to as off-label uses. Now, some of these off-label uses include the treatment of insomnia, where low doses of Trazodone are commonly prescribed for sleep difficulties, especially in people who also have depression. Trazodone may also be used off-label for anxiety disorders, including both generalized anxiety disorder and panic disorders. Post-traumatic stress disorders, PTSD, is also another area where Trazodone is used, particularly for reducing nightmares and improving sleep quality. Also, Alzheimer's disease to help manage agitation and behavioral issues, as well as fibromyalgia, which is for pain management and also to improve sleep. Now, Trazodone is also sometimes used to control abnormal, uncontrollable movements that may be experienced as side effects of other medications and for the management of alcohol dependence. Mind you, all these are off-label uses. They are not necessarily FDA approved, but doctors over the years know that it works for that, and therefore they employ the Trazodone to manage those conditions. Now, let's take a look at how Trazodone works. Trazodone has a two-pronged approach. First, it affects serotonin, a natural chemical in your brain that helps regulate mood, sleep, and other functions. When serotonin levels are low, it can lead to symptoms of depression. Trazodone blocks the reabsorption of serotonin, allowing more of it to remain active. Now, this is one of the ways it is believed to improve mood and reduce feelings of depression. Secondly, it blocks histamine and what we call alpha-1 adrenergic receptors, which is what gives Trazodone its sleep-promoting and calming effects. So if you think of it, that is how, antihistamines like Benadryl also make you drowsy. Now, this combination is why Trazodone can be particularly helpful for people who are dealing with both depression and sleep problems. It addresses both issues at once, more like killing one bird with two stones, as we say. Now let's talk about how to take Trazodone properly. Obviously, you always need to follow your doctor's specific instructions, but here are some general guidelines. Number one is swallow the tablets whole, or if necessary, it may be broken on the score mark. Trazodone tablets usually are scored, so if you have to break it exactly where it is scored. For depression, it's often taken in divided doses 2 or 3 times a day, or sometimes as a single dose at bedtime. If it's prescribed for sleep, you'll typically take it as a single dose just before you go to bed. Now, a helpful tip is to take the immediate release Trazodone after eating something, even if it's a light snack. This can help reduce any potential stomach upset, as well as even prolong the medication's effects. The dosage of Trazodone varies depending on why you're taking it, your age, and some other factors. Obviously, your doctor will determine what the right dose for you, but generally for depression, treatment starts around 150 milligrams daily, often divided into multiple doses. This might be gradually increased to between 300 and 400 milligrams daily. The maximum recommended dose is about 600 milligrams per day. Now, if you're taking it for sleep problems, the dose is usually much lower, typically between 25 and 100 milligrams taking at bedtime. Now, let's take a look at some precautions that you should be aware of. Like all medications, there are some important precautions to be aware of. One serious concern is something we call serotonin syndrome, which can happen if Trazodone is combined with other medications that also increase serotonin levels. The symptoms include confusion, rapid heart rate, high blood pressure, dilated pupils, muscle rigidity, and excessive sweating. And if you experience any of these symptoms, please seek help, medical help immediately. Now, it's always also a good thing to have your pharmacist check for any potential drug interactions before you even start on any medication. Now, another important precaution, like other antidepressants, trazodone may increase the risk of suicidal thoughts, especially in young adults, teenagers, and children. So close monitoring is really important during the first few weeks of treatment or when the doses are changed. If you or someone is experiencing suicidal thoughts, please reach out for help right away. Don't assume that everything is okay. Trazodone can also affect heart rhythm in some people and may cause what we call QT prolongation. Now, if you have heart conditions, your doctor will want to monitor you carefully. Older adults may be more sensitive to the side effects of trazodone, particularly dizziness and drowsiness. Now, let's talk about some things that you need to avoid while taking trazodone. First is alcohol. It's best to avoid alcohol altogether while on trazodone because it can increase drowsiness and dizziness. You should also avoid driving or operating machinery until you know how trazodone affects you, since it causes drowsiness and also can affect your coordination. Another important precaution is not to stop taking trazodone suddenly or abruptly without talking to your doctor. Typically, a gradual dose reduction is usually recommended to prevent withdrawal symptoms. Also, be cautious when taking trazodone with medications that already cause drowsiness, such as sleep medications, pain medications, any opioids, muscle relaxants, or antihistamines. Now, let's talk about side effects. Now, common side effects, and I keep saying this over and over: drowsiness and sedation, dizziness, lightheadedness, dry mouth, headache, nausea or vomiting, blurred vision, constipation and or diarrhea, fatigue and weakness, and sometimes nervousness or confusion. Now, there have also been some rare but important sexual problems in both men and women. For men, there can be a decrease in sex drive, inability to get an erection or maintain one, or delayed ejaculation. And for females also, there can be delayed orgasm or even unable to have an orgasm at all. There are also some less common but serious side effects to watch out for: irregular heartbeat or changes in heart rhythm, fainting or severe dizziness, or priapism, which is a sustained erection lasting usually more than 4 hours in men. And if this happens, this is something that you need to seek medical help immediately to prevent any damage to your organ. There can also be mental or mood changes like agitation, hallucinations, confusions, and signs of serotonin syndrome. Also, there has also been reports of low sodium levels, which can cause headache, trouble concentrating, memory problems, and weaknesses. Like I said, these ones are very rare, but these are the ones that are serious enough for you to pick up the phone and call your doctor and have a discussion about. So when can you expect trazodone to start working? Well, if you're taking it for sleep, you might notice improvements almost immediately within the first few days. For depression, it typically takes about 1 to 2 weeks before you start seeing improvements, with the full benefits possibly taking about 4 to 6 weeks. Now, something important to be aware of is that some people may actually feel worse during the first few weeks before they begin to feel better. If this happens, don't give up. Talk to your doctor about it. Like I said, it takes time for the medication to build up to therapeutic levels. So don't give up because it's not working in the first couple of days. I sincerely hope you found value in this video. Thank you for watching. As always, stay blessed, and I'll catch you on the next one.